Health Today is brought to you by Caribbean Alliance Insurance, agent represented by BGI Insurance Limited.
In this edition of Health Today, we continue our look at ADHD, how to recognize the symptoms and how families can cope.
Understand that the child is not stupid or dumb or defiant, but that the child is having a particular challenge which causes him to exhibit certain behavior.
When you think of Albert Einstein, Sir Richard Branson, Michael Jordan, and Walt Disney, a few things come to mind: creativity, excellence, genius. Certainly all true, but here's another to add. Attention deficit hyperactivity disorder. These brilliant men have all been diagnosed with ADHD, a complex mental health disorder that affects people of all ages from all walks of life. In Barbados, there are no firm numbers for the number of people living with ADHD, but director of the ADHD Resource Center, Alison Lane, tells Health Today they use current international indices, which estimate that at least 6% of the world population is affected by ADHD to gauge the number of Barbadians living with the disorder.
Based on that, our estimate is perhaps every year we're probably looking about 6,000 kids. Not maybe actually a bit high, about 4,000 kids each year in the school setting that may have attention deficit. Also, if you consider that attention deficit is generally considered to be a hereditary disorder, then we would expect that those figures will gradually increase.
ADHD is more prevalent in boys than girls. Many of the symptoms vary and are sometimes too difficult to recognize.
As young as that child is, perhaps is defiant and argumentative. As young as the child is, there's sometimes a severe difficulty in terms of discipline for that child, particularly if you have another child that you're making these comparisons with. But when the child goes into school, that then becomes coupled with a persistent academic failure. They do not thrive well in school because of their inattention and ease of distractibility. And so, for example, of the reports, when the reports come home from school as early sometimes as kindergarten, the reports speak to issues related to inattention, perhaps distracting the class. Sometimes the kids' behavior is not just distracting but disruptive.
If ADHD is not diagnosed, treated, and managed, it will continue in adulthood.
Typically what you see is individuals with attention deficit will last maybe 2 or 3 years in a job. So if you were to look at their CV, every 2 or 3 years they've changed jobs. The job is novel for maybe 6 months or so. Lots of new assignments, lots of new things to do, particularly if the area is developmental. And then, one day it's a job.
There is no single test to determine if a child suffers from ADHD. Lane says the diagnosis involves gathering information about the child, his or her behavior and environment. Increasingly, teachers are becoming more aware of the disorder, and the center has trained about 340 teachers to better help students. But Lane is concerned that in the home, parents have a difficult time coming to terms with how to tackle the problem, even when their child is displaying all the symptoms.
There is this prevailing idea that the child will develop out of it, and it's not a big issue, just kind of wait. The challenge that presents is if you wait too long, then certainly from an academic point of view, and very often from a social point of view, the child then is left behind.
Deferring treatment for a child who needs help can have serious consequences. Lane points to a study by the UK Department of Health which shows that 45% of youth offenders and 40% of adult criminals have ADHD. Closer home, a survey carried out at the Government Industrial School back in 2007 to examine the prevalence rate of ADHD among juveniles painted a similar picture.
When we then had analyzed all the information from the screen and so on, what we found is that there were about in equal gender equality, if you will, in attention deficit. Approximately 24% of the girls and boys at JS were screen positive for attention deficit hyperactivity disorder. So, I think perhaps that's just an indication of what we're talking about.
The center is now preparing to do a similar screening of the adult prison population. Attention deficit hyperactivity disorder is readily treated nowadays with psychiatric medications and psychotherapy. But Lane points out that treatment isn't just about taking medication. He says there are many other effective ways to help children improve their ability to pay attention, control impulsive behavior, and curb hyperactivity.
What we know that works for children with attention deficit is parent training. So in other words, you're training the parent how to work with a child with attention deficit, because a child with attention deficit normally will present some challenges, particularly if the parent has had other kids who've not been affected. Then the other element is working with teachers to help teachers to understand how to work with a child. Then there's often going to be an evaluation. This is one of the reasons that we refer to the psychiatrist, or the pediatrician. At that point, they will also make an evaluation based on their findings as to whether the child should be considered for drug therapy.
He further advises parents to improve their skills, pay closer attention to their children, topped up with care and lots of love.